Ladies and gentlemen, welcome back to Leaders at the Table. I'm Cornelius Banks, and it's such a great pleasure to see you all again, or for you all to see me. We have a new guest. Dr. Sarita is here with us, along with Dr. Sheena. Dr. Sarita, welcome to our Leaders at the Table. How are you today?
Great, thank you. It's great to see you.
Yes, thank you for joining us for this conversation. Our topic today, ladies and gentlemen, is aging with dignity. And we've asked Dr. Sarita to come to kind of give us some insights from her work at the SCAN Foundation. But before we get into that, Dr. Sarita, could you introduce yourself? Tell us who you are, the organization that you represent.
Yeah, happy to. Well, it's a pleasure to be here. My name is Sarita Mohanty, and I am a practicing internal medicine physician and had the privilege of serving as the president and CEO of the SCAN Foundation for a little over the past 4.5 years. At the foundation, it is our mission to advance a society where we see all older adults access home and community care and supports. And we do this through grant making and impact investing. And so we are really thrilled about this conversation. Obviously, it's near and dear to our heart here at the organization because we see that older adults are experiencing grave challenges to age well with dignity in the United States, and especially those that are historically marginalized, lower income, communities of color, those that are in rural settings that have under-resourced geographies. So this is the work that drives me and drives all of us at our foundation. So again, really excited to talk more about this.
Oh, awesome. Thank you for joining us. Dr. Sheena, welcome back.
Thank you, Cornelius. Glad to be back.
Yes, happy to have you here at the table. So Dr. Sarita, hopefully it's okay to call you Dr. Sarita. How does a person become an internal medicine physician and become the SCAN Foundation president, CEO?
What I'm seeing now, fast forward in my now as the CEO, president and CEO of the SCAN Foundation, is these same skills that I learned as an internist are being applied to me leading a philanthropy that is really focused on one of the most important issues, I believe, of our time, our generation, is how do we allow older adults to age in home and in communities? So because you can't just address the chronic conditions. You've got to look at the whole environment. You got to look at their behavioral health, their mental health needs. You got to be thinking about social isolation, loneliness. You need to be thinking about the fact that do they even have caregiving support to get them to help with their activities of daily living or other activities. That's why I try to make these parallels. And so what we're doing, just to round this out, is that we are really listening to older adults, their caregivers, their community. We call it our lived experience approach, serving older adults. And it's the heart of the work and how we actually aim to inform policy that will change, improve the lives.
So you're speaking is like one of the stats that was very interesting to me was the U.S. population is older today than it has ever been. And is that because of the baby boomer generation, as now they're all over 65, and now we're faced with this opportunity to provide them with more holistic care, taking in what's going on in the environment in which these individuals might live. And one of the terms that's really stuck out to me, the forgotten middle.
Yeah.
Why that term? How do you all approach it? It's really intriguing. I just want to get more insights of how you and your team, define that.
We didn't develop that term. We built on it, and we actually funded more research to learn more about this population. It's always been a population that's been really important for us to understand. Think about the millions of older adults who are on Medicare and are lower to lower moderate income in terms of this population. So we did this analysis in 2023, 2022, 2023, and basically what we found, and I'll just kind of give you this it's like that many middle income older adults and tend to be more racially diverse, particularly Black, Hispanic, and rural populations as well. We projected that they will not have access to those critical care housing supports in the next decade. And actually that size of that lower moderate income population is going to double and become increasingly more diverse by 2033. And again, what we're finding is that people in this category, how are they going to get long-term care? One statistic that I will just say that is really telling from this analysis we did with NORC is that nearly 75% of middle income older adults will be unable to pay for private assisted living without selling their home.
Wow.
So
and spent a lifetime
yes.
paying off a mortgage, and then that still isn't enough. As it relates to health, so as you age, right, there's still opportunities to engage from like a payer perspective.
Yes, Cornelius, so you brought up an interesting, and I really resonate with what Dr. Sarita is talking about on a holistic healthcare and how to reach the elderly population in different ways. And so what we've developed really at Simple Healthcare is a comprehensive platform that is engaging people where they are. And when you think of the elderly, they're, maybe they're bedridden, maybe they don't have enough caregivers, and how can you engage those even all, from all walks of life, members at home, patients at home, individuals at home. And so what we do is we engage the member, we'll deploy these programs directly to the individual's home, and these are all the way from colon cancer, diabetes, and these are for the first time where we get to work with payers and providers and deploy these programs directly at your home. We'll handhold you through our digital platform, step by step, to get these screenings done.
But, as we talk about payers, Sheena, I know that you do a lot of, your team do a lot of work with payers. We're in this whole environment about Medicare Advantage. How does that work with this population? How have you been able to integrate that with certain payers, et cetera, in your work? You get some insights too.
Happy to give you some examples of the work. So we all kinds, like the greatest of them all, from the national, regional, to the scan health teams, right? There is not enough resources. We're made to do a lot more with a whole lot less. And we come as a perfect partner for a lot of our partners, health plans, the health systems, pharma partners. But the idea is that we, instead of having so many, there's not enough resources, not enough providers, not enough care navigators, but how can you use technology in a thoughtful way? I know now AI, like we're in the forefront of AI. I know I use AI all the time. How do you really take the technology and make it work for the people you serve and the partners you serve? So that is one way where we see our health plans. If patients are not coming into these brick and mortar, guess what's happening? They're ending up at the ER rooms. Nobody wins in that system. You have a chemotherapy, dialysis, no one wins. The payers don't win, providers, definitely not the patient. So where we get to build is this whole platform where now we'll engage you, we'll be your personalized assistant, get you to care. You're getting early detection. The health system, the payers, everybody is finally all incentivized for this to work. So the win-win across the board.
From your position as a clinician to being the president of the SCAN Foundation, what are some of the biggest challenges that you're seeing from a chronic disease management in the elderly population? Because I'm trying to understanding what Sheena's team is building as it relates to deploying into the population. We want to ensure that we're developing the right tools to meet what you're seeing on the ground and within the population that you seek to serve or continue to serve.
Yeah. Well, first I will say I am really thrilled to hear about this energy and this commitment to bringing services to where people are. As you said, you think about so many people who have some form of disability, disproportionately, you see that in older adults. It's very difficult to get to a bricks and mortar, and to be able to, one, I think, is being able to, offer those services in the most convenient location for them, which if they're at home or, in a community setting, great. And then the other thing is making it simple so that the payers and providers have that information, that they can readily react to it or act on the next steps based on what you find out. And how do they, get that treatment in a efficient way and effective way. So I really love that. And I think what we found, to date is that the unique experience of aging in America, one of the roles is trying to be able to coordinate with data and information. And I know back in the day, we didn't even have as much AI as we do now. So to see that you can start to bridge and make these things more efficient is really important. I will just say that I think when we're thinking about complexities and the challenges, I think, Sheena, the work, Dr. Sheena, that you're doing is great. And also continually making sure you listen what these populations, how they're faring, how how are they experiencing the system?
Outstanding. Thank you for your time. Dr. Sheena, do you have any other things? Because, I'll monopolize this whole conversation and just be asking Dr. Sarita everything.
No, I think what I love about this conversation is about these are real problems. This is not like a shiny little object here in the Silicon Valley. These are real world problems everyone can connect. And healthcare is one area. Like I think if we just focus on the human element of how to be thoughtful, the basics, a prayer my mom taught me, the Our Father, was give us today our daily bread. Like it's literally asking God for a basic. And when you talk about basic, it's like housing, like the work I know Dr. Sarita is doing, affordability, healthcare, access. These are basics. And I'm excited to work with kind-hearted leaders and partners that have to come together and really push those barriers to kind of give the basics access to healthcare, and we get to
do it.
Part of that.
Yeah.
We don't think about it until it hits our front doorstep, to be honest with you. You're young until you can't move like you could. Then it's like, oh, this is a problem. But in closing, Dr. Sarita, anything that you want to share with the good people as we say goodbye on this episode?
No, I mean, I would just say that, some of the things you said, Cornelius, and what Dr. Sheena said are continuing to resonate with me, which you talked really briefly about the fact that, even if you're 80 years old, it doesn't mean you have no purpose. And one of the things in our vision statement is all of us age well with purpose. That is our vision statement at the SCAN Foundation. And and I think what we're seeing is a lot of continued ageism. Like you said, well, when you hit a certain age, you can't do this or you can't do that. And it's like, no, people have, yes, there, maybe more disability as you age, but it doesn't mean you can't live with purpose. And that's really kind of at the root of what I think Sheena's saying, giving people the basic needs, letting them do what gives them joy, and making it simple and easy and convenient, I think is where I think we need to go. And I just want to make sure that we we don't overlook the people that have less resources, less access. We gotta level the playing field when it comes to these basic human needs. So I think it's a really good, important conversations. I hope people continue to have these types of conversations when we talk about aging with dignity. So appreciate it.
Well, thank you, Dr. Sarita. Thank you, Dr. Sheena. This concludes this Leaders at the Table. We'll see you all next time. Take care.